One of the main skills we learn as social workers is how to complete biopsychosocial assessments. Do you remember those assessments in social work school? Those long 1 to 2 hour assessments? You know, the ones where we basically wrote a novel about our client's life story. Hospital social workers don't have time for that. Our caseload is between 20 to 30 patients, sometimes more. So we don't have 1 to 2 hours to designate for each client to go over their whole life story, as much as our patients would want us to. In this video, I'm going to be going over how hospital social workers condense their biopsychosocial assessments in half the time or less. My name is Tabby, and I'm an LCSW with over 12 years of social work experience in the healthcare field. And I'm here to bridge the gap between what you learn in social work school and real-world experience. The healthcare field for social work is a whole different ballgame. As I said, our patient caseload can be between 20 to 30 patients, and sometimes we have to see all of them in the same day. In an 8-hour day, not only do we have to do an intake assessment, but we also have to work on treatment plans, discharge plans, we have to coordinate care, we have to contact families, and not to mention, we also have to deal with everything else that gets thrown at us because no one knows else how to do it. So let's go ahead and throw it over to the social worker. They'll know how to do it. Biopsychosocial assessments are still important for hospital social work, even if we don't have 1 to 2 hours to spend on it. In my opinion, they serve 3 purposes. A biopsychosocial assessment helps ensure a patient's successful recovery. It helps us to identify barriers to care, and it helps us to limit readmissions back to the hospital. So I'm going to go over with you how I complete biopsychosocial assessments in 20 minutes or less. The very first thing, and for me, most important thing that I do is I complete a chart review of each patient that I see. That means I go into the patient's chart and I gather as much information as possible to complete my biopsychosocial assessment without going and seeing the patient first. This is important because the more information I can gather about the patient, the less repetitive questions I have for the patient. The patients are already being asked similar questions by doctors, nurses, and therapists. So when I complete a chart review, I make sure to look at the face sheet, and sometimes I print them off, because the face sheet is going to give us information about where the patient lives. It's going to tell us information about their emergency contact, their next of kin, health insurance, and their financial information. I also look at emergency department notes. I look at those because oftentimes it'll tell me how the patient arrived to the emergency room, which gives me an indication of if they have someone that might be available to take them home on discharge or to appointments. It's going to give me indication of the method that they came in. Was it a stretcher transport? They're probably going to need transportation back home if that's the case. Was it a wheelchair? It tells me a little bit more about their mode of mobility. It also can give me some indication of who brought that patient in, and if there is a caregiver or someone that I can contact that might not be on the face sheet, but still would have pertinent information about the patient. And then, of course, there's the history and physical, which I think is probably one of the most important places to look when doing a chart review besides the face sheet. The history and physical is going to give us information about why the patient came in, what their potential diagnosis is, what testing and procedures they might need. And then also, a lot of the time, doctors, if they're good, will put a brief summary of the patient's social history and family history. I also like to look at consults. Consults can be helpful because it'll give us indication of what other specialties are involved in the patient's care. So for example, if a patient came in with a heart condition, more than likely cardiology is going to be consulted, and then I can start following their notes. It's important to follow the specialty physician's notes as well, because they have their own recommendations for patients. And before a patient can discharge, all specialties that are working on the patient's case have to sign off on their discharge before they can leave. So we want to make sure that we're taking into account the specialty's recommendations, the attending physician's recommendations, and of course the patient's goals. And then the other important place I like to look is, of course, therapy notes, if there are any. So physical therapy, occupational therapy, and speech therapy all have really great notes. They're going to give us information about what the patient's prior level of functioning was, what their living situation is, if they're needing any assistance prior to hospitalization. Additionally, they're going to give us their own recommendations of what kind of care they think the patient is going to need. That helps us a lot with our discharge planning. So if they are recommending that the patient need to go to a skilled nursing facility, that tells us that we need to go and talk to the patient about the potential discharge plan of going to a skilled nursing facility. Nursing notes can also be helpful. It helps me get an idea of how the patient is during their stay, how they're interacting with the nurse, whether or not they're compliant, whether or not they are having memory issues, if they're emotional. It gives me a good indication of what I can expect from the patient when I go and meet with them. And then I personally like to see if the patient had any previous admission notes. Did they have any other hospitalizations with us in the past? It gives me an indication of what kind of services the patient may have had before, what agency they were using, and whether or not they want to use those same services or agency, or if they even meet criteria for those things. Sometimes it'll also give me some contact information that maybe I don't have on this visit. I also created a template that gave me an outline of all the questions I really needed to talk with the patient about to complete my biopsychosocial assessment. I also like to print out the face sheet. I like to do this because I can kind of use that as my template sometimes, and it also, I can go ahead and just verify that we have correct information on the patient as well. We want to make sure that we're verifying the information that we do have, because information can get lost in translation. Do you remember that game, the telephone game? You know, where you whisper into someone's ear a phrase and it goes around in a circle until it comes back to you, and then the phrase is like not even close to the phrase that you had initially started with? Well, charting can be kind of the same thing. So just because a doctor or a nurse has asked a patient a question and they gave them an answer doesn't mean it was an accurate answer, or doesn't mean it was accurately notated in the patient's chart. So I always like to make sure to verify the information that we do have is correct. To be able to complete a biopsychosocial assessment in a condensed period of time, you definitely need to set the scene for that time period. For example, you'll want to introduce yourself, explain your role, what the visit is for, and then I like to set a time period that they can expect to spend with me in that visit. So for example, what I would do is when I would go into the patient room and I would do this. Hi, my name is Tabby and I am the social worker here for such and such hospital, and I'm here to work with you on care coordination so we can kind of plan ahead for your discharge needs whenever that time comes. And I'm going to be spending about 20 minutes with you asking you these questions. Doing an introduction this way and giving your patient expected time frame to complete the assessment is going to help you manage your time lots better. It also makes having to leave the conversation early a little bit less awkward sometimes. Then we also have nonverbal observation and communication. Just like you would at any biopsychosocial assessment you've done before, those nonverbal observations are also really important. I can look around the patient's room and notice whether or not they have a walker or a wheelchair, or if they're on an IV. This will give me an indication of possible potential needs the patient might have and that I'll need to coordinate for their care upon discharge. Additionally, I like to get further information from families if I can, if the patient allows me to. Or if the patient has memory issues, then of course I'm going to need to talk with a family member to get more reliable information. You also want to make sure that you discuss the discharge plan, what the options are, and you want to go over any barriers. And then I always make sure that I understand what the patient and or family's discharge goals are, and if they align with the recommendations. If you're new to hospital social work, it can take some time to get used to doing biopsychosocials in such a short amount of time. There's definitely a learning curve. That's why I recommend either using a template or printing off a face sheet that you can take with you to kind of help guide your assessment and stay on task and better time manage. And remember, for hospital social work, the biopsychosocial assessments main focus is discharge planning. If you are interested in using the same assessment template that I often used, then sign up for the newsletter down below for a free downloadable template assessment. And of course, if you liked this video and want to learn more, please hit the subscribe button below and the notification bell, and you can be notified when new videos are posted.